Hi, my name is Karina, and my speech is about the shortage of surgical masks during COVID-19. And I think that if we get the people that know how to sew to make masks with like leftover material that they have, or even like if they can afford to buy new masks, they can make some and sell them or donate them to people that don't have any. Um, the CDC is now recommending that everyone wear like a surgical mask when they go out in public, when they need to get like groceries or anything that they really need. So I am currently a fashion major, and I know a lot of people that do know how to sew. So I think that it's like we could definitely get together and start making some masks and selling them, or just donating them to people that don't have one. So many health workers across the country do not have a mask right now, or do not have a lot. So that's a major problem. According to Nuremberg 2020, the shortage has gotten really bad, and some healthcare workers even have to reuse their protective wear, which is really bad because they do like sanitize them, but they could even still have like germs and stuff on them and possibly like infect other people. Many people like that are just normal do not have the opportunity to even like get a mask unless they buy one online maybe, and I know that a lot of them are really overpriced right now. And people that can make the masks can donate them, like one for each person in the household, and maybe even give some out to the homeless around the town. So in order to make masks, certain materials should be used rather than like others. So they recommend that tight weave cotton fabric should be like washed, and it should be newly purchased and within the past year, and that it's never used. And this is from an article called How to Donate Hand Sewn Face Masks. And it was made in 2020, very recently. And they recommend that you use rope elastic to put around the ears. What I thought was very interesting is that it has to be purchased within the last year. I know that in our department, in the fashion department, we have a lot of material that's donated, and we're not really sure when it was purchased. So we would have to purchase new material to make sure that it would work well. And so according to that same article, Centers for Disease Control don't suggest cloth material as a first-line defense against the coronavirus, but it will work well with people that already have like underlying conditions. So the importance of these masks isn't necessarily like for people who work in hospitals and stuff, because they're not really as protective as the ones that they need. So the way that these can help is by giving them to people who work in or that do not like work in hospitals. They're just everyday people, so that we can reserve like the respirator masks for people that do really need them, that are working in hospitals. So before or when these things are donated to people maybe in the hospital, like patients rather than the doctors, they are heavily like laundered and sanitized before they're even used, but they do suggest that you wash the material before you like donate them. And so these masks will help prevent the virus while going out in public. According to Parker Pope 2020, a simple face covering will have enough protection for someone who is just practicing social distancing. So if you're wearing a mask and you're just like, you are practicing social distancing, it will be very effective. And thicker fabric does work better, even though it can be like very hard to breathe. A lot of people do suggest the quilter's fabric because it's like a thick tight weave cotton. And these masks also help you from touching your face while you're in public. Because I know it's very hard to do that, and even if you reach up to touch it, you're going to be touching your mask. And some protection is better than none when you're going out in public. Overall, handmade masks can be very effective, especially during this time, and it can help solve the mask shortage problem, especially for healthcare workers that really need the respirator masks, and people that are just everyday people that need them for going out won't be using them, so that we can save them for healthcare workers. So homemade masks can majorly help the population by providing protection while people go out in public. Some protection is way better than no protection. Thank you.